Hello, golfers. I recently had the opportunity to watch the swings of some superb women professional golfers during the Hugel Air Premier LA Open 2021 at the beautiful Wilshire Country Club. Brooke Henderson, who won the event, Jessica Korda, who was the leader for the first 3 days, Lexi Thompson, Angela Stanford, and LA's own Lizette Salas were some of the golfers I got to look at the swings of. So it was interesting to look for any research on the subject of female golfers to understand whether their swings might be different from those of their male counterparts. One really great study by an Australian research group that compared 19 men and 19 women, all below 4 handicap and all using a driver, provided a lot of useful information. Note that the results shown in this table were adjusted for golfer height and mass, designed to make the numbers more comparable statistically. Females had rotated both the thorax and pelvis open to a significantly greater degree than men at ball contact or BC. We see these huge rotations that impact in the movement of some LPGA players too, even with the shorter clubs than the driver. Also, females had rotated the pelvis with similar axial angular velocity, but the thorax significantly more slowly. We presume the former because this table lists all significant differences and pelvic angular velocity is not listed as being significantly slower in females. So, a question that comes to mind is, if females are capable of rotating a larger pelvis at similar angular velocities to males, why might there be a loss of energy transfer up the kinematic sequence from pelvis to thorax, leading to it being relatively slower? Delving further into the paper, men and women move their bodies differently during the downswing to deliver the club to the ball at BC or ball contact. While men have a larger amount of side bend of both the pelvis and the thorax, women have more of a forward bend of the pelvis. And this forward bend of the pelvis might, perhaps, prevent a smooth transfer of energy from the pelvis to the thorax and lead to the significantly slower thoracic angular velocity seen. Why might forward pelvic tilt affect thoracic speed? One must-read article on the kinesiology of the hip joint explains that as flexion or forward bend of the hip increases, the external rotation of the hip reduces. Keep in mind that the trail hip has external while the lead hip has internal downswing rotation, as it is the pelvis that rotates over fixed femurs. The reason is that some fibers of the gluteus maximus muscle acquire a smaller moment arm for external rotation even at the average of 7 degrees anterior or forward pelvic tilt seen in the females of the Horan et al. Research. At about 40 degrees of forward tilt of the hip joint, the fibers of the gluteus maximus would begin to work like internal rotators, making external rotation rather difficult. In this graph, the vertical red lines indicate 7 degrees of forward hip flexion and how already the external rotation ability of the hip reduces compared to when there is no forward bend of the hip. Of course, there are many reasons other than forward pelvic tilt that might contribute to reducing transfer of energy up the chain. However, the question remains, why do females and males have a different downswing body movement strategy? Firstly, why do golfers have any side or forward tilt downswing strategy at all? If the two hip joints were level at the end of the backswing, neither strategy would be required, as there would be no need to level out the two hips so that pelvic rotation might begin, which it needs to do in the horizontal plane. Also, why do females rotate the pelvic region to such a great extent even with the shorter clubs as seen in these pictures? While females are in general more flexible, why should there be so much range of motion? Does it benefit their performance in any way? Might it create more low back pain? As much research is not conducted into female swings, it is a topic that must be assessed on an individual basis by a golf science consultant with a background in both biomechanics and musculoskeletal anatomy. Should females be trained to use side bend during the downswing like male professionals do? No, because research has shown that side bend combined with horizontal rotation is a big cause of low back pain. Additionally, a side bend might increase the angle of attack of the club too much as the trail side of the torso drops down more steeply. Basically, females need to have much simpler swings for better performance, greater consistency, and less injury risk. Perhaps females might be better served with a setup and backswing which reduces the need for so much pelvic rotation. Look at how much these women rotate and consider how injurious it might be to the low back. Additionally, a more upright setup posture that is not changed much during the back and down swings will reduce forward tilt, which is also known to be a causative factor for low back pain and which may reduce performance capability as discussed earlier. Is all that even possible to do? Yes, I have developed a golf swing which achieves just that through 28 years of painstaking research. A more suitable swing for the female body is certainly a must for all female golfers, both amateurs and professional. To learn more, get in touch.